Fever FM, the number one choice in Leeds.
Welcome to Fever FM, Nusrat.
Oh, thank you very much for having me. It's nice to be here.
It's nice to have you, such a lovely personality here. Describe yourself to us. What do you do?
So I'm a dietitian. Currently, I would say I'm a diabetes dietitian, and I also do some freelance work. So I work privately as well,
Right.
and I work for different surgeries. So at the moment, I work for West Leeds PCN. So it's a primary care network, so where loads of GPs have got together and they use me as a dietitian. So there's something called the ARS scheme, so the Additional Roles Reimbursement Scheme, where they've been able to get people in, like healthcare professionals, like dietitians, pharmacists, physios and things like that. So we all work together across the GP surgeries. So hopefully people have had loads of phone calls from pharmacists and doctors and things.
So, इसका क्या मतलब है कि आप डाइटिशियन की एडवाइस देती हैं?
जी, so मैं मोस्टली डायबिटीज़ में फोकस करती हूँ. So मेरी जो रोल है ना PCN में, मैं सिर्फ डायबिटीज़ कवर करती हूँ.
Oh, अच्छा, that's good.
3 दिन मैं सिर्फ डायबिटीज़ के बारे में पेशेंट को बात करती हूँ. So any newly diagnosed डायबिटीज़ हो या जिसकी डायबिटीज़ ज़्यादा थोड़ी सी ख़राब हुई है, so HbA1c ऊंची हुई है, या जिसको हो सकता है इंसुलिन चाहिए, so उनके लिए इंसुलिन को अवॉइड करने के लिए डाइट के बारे में थोड़ा सा, या लाइफस्टाइल चेंजेस के लिए ऐसी चीज़ें.
Can you please take us, stage by stage कि कैसे एक आदमी को just सिर्फ getting bit of diabetes, थोड़ी बहुत ही उनको या किसी ने कहा है या कि डॉक्टर ने उन्हें एडवाइस दी है कि अपनी डाइट पे कंट्रोल करो. When and how soon they should start on this diet?
So डायबिटीज़ के बारे में या एनी डाइट जितना मर्जी जल्दी कर सकते हैं बेहतर होता है. बट एविडेंस या आजकल जो है ना रिसर्च में है जे आपको थोड़ा सा वज़न लूज़ करें, ऐसे स्टोन या 2 स्टोन, आपकी डायबिटीज़ रिवर्स हो सकती है. सो एनी टाइम पे ऑब्वियसली डायबिटीज़ 6 साल से हो ना, इसके बाद then higher chances of remission होती हैं. बट मेरे पास पेशेंट हैं तो 70 साल के हैं, 80 साल के हैं, उनकी डायबिटीज़ में कमी हुई है. सो उनके पास अभी डायबिटीज़ थी और 3-4 महीने के बाद वज़न लूज़ हुआ है या डाइट चेंज किया और अभी डायबिटीज़ नहीं है. सो प्री डायबिटीज़ नहीं है. सो some people have had diabetes for a long time and we're helping them go into pre-diabetes or remission. So very interesting work for me. It's very nice to see.
अच्छा खाना पीने से जो है कि डायबिटीज़ का खात्मा मुकम्मल तौर पे हो सकता है.
So कई जो डॉक्टर्स एंड नर्सेज के लिए डिफरेंट लफाज हैं. सो एक जो रिमिशन है, जो आपका वज़न लूज़ हो और जो फैट लिवर में हो या पैंक्रियास में हो वो भी लूज़ हो, तो फिर वो पैंक्रियास और लिवर थोड़ी सी बेहतर काम करती हैं, तो फिर आपकी डायबिटीज़ ट्रूली रिमिशन में होती है. एक होती है जो मिटिगेशन होती है, जो आप शुगर कम करें या डायबिटीज़ के फूड जो कम करें, सो कार्बोहाइड्रेट्स जो वाले फूड हैं वो थोड़े से कम करें और लेकिन आपका वज़न ना नीचे हो. दैट्स कॉल्ड मिटिगेशन. सो उसमें आपकी खाने में कंट्रोल है, सो तो डायबिटीज़ नहीं है बिकॉज आपको फूड नहीं खा रहे, शुगर नहीं खा रहे. बट इफ़ यू स्टार्ट ईटिंग द शुगर्स और द कार्बोहाइड्रेट्स अगेन, तो फिर वो डायबिटीज़ जल्दी से मुड़ सकती है. सो there's 2 different ways of looking at it, I think. Very interesting.
कैसे is ये आसान है सब कुछ छोड़ देना, शुगर वगैरह, कार्बोहाइड्रेट्स, whatever आप कह रही हैं. Is it easy to do?
There's different ways. I think if we can move people towards healthy eating and healthy portion sizes, anything's possible. So I think that's mostly what it is. I think when we eat chapatis and rice, we pile our plates up with rice and then we have lots and lots of chapatis. That's not healthy eating. So there's too much carbohydrate. But if we can bring people down to healthy portions, 3 meals a day, 4 meals a day, it's completely possible. And sometimes it's the way they eat the food that we need to change. So हो सकता है कई लोग सिर्फ एक meal खाते हैं बड़ी सी शाम पे, but if we split that meal up and eat it smaller, that can make a huge difference.
Well, that's very nice, really. छोटा सा breakfast लें, lunch थोड़ा सा लें और फिर शाम को थोड़ा सा खाएं.
जी.
Yeah, that's nice. That's interesting, really. And I suppose, क्या ये आम होता है अपनी society में कि हमारे लोग ज़्यादातर rely करते हैं on one big meal?
I think in the South Asian population, yes, maybe evening meal tends to be a bit bigger, or traditionally people do eat 2 meals a day, which has got chapatis or rice in. So obviously that's a lot of carbohydrate. So people think diabetes is just sugar, but actually diabetes is bread, pasta, rice, potatoes, cereal,
सभी कुछ
anything with
तो फिर खाने के लिए क्या रह गया बाकी
You could eat them, just smaller portions, so healthy portion size.
What is an ideal diet for a person, is there anything like that or
So the diet for diabetes and for most conditions is healthy eating advice, but we just tailor it to different people. So really, if anyone's heard of the Eat Well Guide and things like that, it really is the Eat Well plate and healthy eating. So making sure you're eating 5 fruit and vegetables a day and having a selection of them, having protein in your diet. So often, ज़्यादातर Asian family में protein इतनी नहीं होती. So they focus on the carbohydrates and don't eat enough protein.
कौन सी ऐसी चीजें हैं जिनमें प्रोटीन जो है वो ज्यादा होती है
जैसे अंडा हो, मीट हो, चिकन हो, फिश हो. So ऐसी चीज़ें थोड़ी सी होनी चाहिए मील पर. That's really helpful. तो फिर obviously जो fatty foods हैं वो थोड़े करें, कम करें. उनमें भी शुगर होती है, फैट होती है. So दोनों चीज़ें आपका वज़न भी बताती हैं और obviously शुगर को भी बताती हैं. So controlling those sorts of snacks or या केक्स हो, बिस्किट्स हो, ऐसी चीज़ें जो उनमें शुगर भी होती है और कार्बोहाइड्रेट भी होती है. So ये एक्स्ट्रा चीज़ें निकाल दो तब भी डायबिटीज़ अच्छी हो सकती है. So कंट्रोल हो सकता है. So it's not everything.
yeah. It's, looking at the gadi ki taraf dekh raha hu. It's lunchtime now.
Yeah.
And people are supposed, a lot of them are thinking about eating or they're eating at the moment. आपके ख्याल में कौन सा क्या खाना चाहिए कि which is, at this time there's loads of takeaways, people go out really for a quick something. Ideally क्या उन्हें खाना चाहिए? किस चीज़ को avoid करना चाहिए इस वक्त?
For diabetes or just generally?
Well, generally.
Yeah, I think generally just a healthy meal, so a little bit of protein, उसमें carbohydrate भी हो, और vegetables ऐसी चीज़ें हो. So sandwich अच्छी है, but the sandwich needs to be like very good bread. So granary bread जो वो seeds में होते हैं ना, वो सबसे अच्छी bread है. वो diabetes के लिए अच्छी है, वो fiber के लिए अच्छी है, वो bowels के लिए अच्छी है. So lots of things. That उसमें डालें, थोड़ा सा butter डालें, margarine जो आपकी मर्जी है, और थोड़ा सा protein हो, अंडा हो, fish हो, chicken हो, ऐसी चीज़ें ठीक है. और थोड़ा सा सलाद हो या वेजिटेबल्स हो साथ में. डायबिटीज़ हो तो बेहतर सैलड खाएं, फ्रूट इतना नहीं खाएं, उसमें भी शुगर होती है. डायबिटीज़ नहीं है तो फ्रूट ठीक है.
Oh, right. Yeah, I'm just looking around here, we are right on Roundhay Road and there is so many takeaways, shops here where we can go and some nice food as well. लेकिन एक भी सैंडविच की दुकान नहीं है यहाँ पे.
और ग्रिल्ड फूड भी अच्छा है, चिकन ग्रिल हो, मीट ग्रिल हो, ऐसी ठीक है, but obviously portion size, but उसके साथ चिप्स ना खाएं.
All right.
उसके साथ सैलड खाएं या ऐसी चीज़ें खाएं. So you can make any meal healthy, just obviously trying to think differently. It's all about mindset, isn't it? So changing the lifestyle. If you know you've got diabetes or a health condition, it's changing that lifestyle. If we just sit all the time and we know we've eaten lots of food and we've not moved all day, then that sugar's not going to go anywhere. Or if you're not diabetic, if you're just sitting all day and eating, a lot of people in COVID have put weight on because we're not as active as we used to be. So it's the healthy guideline is half an hour or 30 to 40 minutes across the week, isn't it? So building that activity into your lifestyle is really important as well. I think when we were younger, a lot of the South Asian community, ये भी जानते हैं ये कितने active थे, सब चीज़ें हाथ में होती थी ना, वॉशिंग भी होती थी, क्लीनिंग भी होती थी, ऐसी चीज़ें बहुत एक्टिविटी होती थी. अब हम ज़्यादातर खाना फूड में डालते हैं, माइक्रो में डालते हैं या ओवन में डालते हैं, फिर खा लेते हैं, फिर बैठते हैं, फिर टीवी देखते हैं, फिर फ़ोन पे. So there's a lot of
so that laziness plays a
inactivity.
big part.
I don't think it's laziness. I think it's inactivity. और हम सोचते नहीं हैं जो हमने आज मूव किया है कैसे, फिर वो रूटीन बन जाती है ना, फिर we get more and more tired by doing that. So actually being a little bit active helps your energy levels. I think people think, I've not moved all day, I'm really tired, or I've done lots of housework, I'm tired. But actually, we still need to do a little bit of activity in addition to that housework because, that's not activity. You're moving around a little bit in the house. It's good, very good to include it, but much, much better to do a 10, 15-minute walk, 5-minute walk, whatever you could get into the day is much, much better.
Oh, that's brilliant. That's brilliant. So this is for the people who are just sort of getting into this and, they can avoid it. क्या मुझे बता सकती हैं कि people who've been suffering for a while, diabetes say, and it can be really, really, bad for them really. लोग जाने भी अपनी देते हैं इस बीमारी से. The people who were suffering long time, उनके लिए क्या, सिर्फ इंसुलिन वगैरह या कि, दवाइयाँ ही काम करती हैं या कि can they still?
Yeah, it's tricky. So मैं जो है ना, मैं English patient के साथ अच्छा होता है, easy होता है, वो take your advice, they listen to it, they make changes. I really struggle with South Asian patients. They listen to all the advice, they say they will do it, but then they don't really take action. So South Asian patient में कम changes में देखी हैं because वो खुद तब्दीली नहीं करते. So उनका वज़न भी नहीं नीचे आता और उनकी डायबिटीज़ भी नहीं बेहतर होती. So to control that, they need more tablets. So ये डाइट पर चेंजेस नहीं हो रही, फिर वो टैबलेट ऐड होते हैं, फिर वो नहीं कंट्रोल होती, फिर वो इंसुलिन ऐड होती है. So these medications are added because we're not changing the lifestyle and we're not changing the diet. So if we made changes, we can reduce the insulin, we can reduce the medication. If we lost weight, again, we can reduce the insulin, we can reduce the medications. As I said, there's so many patients I've seen this year that have come off medicines, have reduced their insulin, have come off insulin.
Yeah.
So it's completely possible now. It's not like it used to be before. हम पहले कहते थे डायबिटीज़ है तो फिर ये पूरी ज़िंदगी में होगी और आपकी रिस्क जो होते हैं आँखों पर डैमेज होता है, किडनीज़ पर होता है, ऐसी चीज़ें ये जब होती हैं जब कंट्रोल आपकी डायबिटीज़ में अच्छी नहीं होती है और सालों से हिसाब पे होती है, like 5-6 years पे आप ज़्यादा आपकी कंट्रोल नहीं अच्छी होती. सो जब आप बिल्कुल एहतियात नहीं करते तब वो इश्यूज होती हैं किडनीज पे, हार्ट पे, ऐसी चीज़ें. सो जब ग्लूकोज जाती है ना बॉडी में, वो जितनी ये छोटी सी वेसल्स होती हैं आँखों से पीछे, पैरों में, किडनीज में, ये थोड़ी सी डैमेज होती हैं ऐसी. सो इसमें तब जब शुगर हाई होती है ना फिर वो डैमेज ज़्यादा होती है और फिर वो ब्लड द ग्लूकोज सर्कुलेट्स राउंड, वो राउंड फिरती रहती है और वो सिर्फ यूरिन के सिवा जा सकती है या स्वेट से ज़रिए. So obviously that's when people go to the toilet a lot. We all know diabetes की symptoms यही होती है ना, sweating होती है, thirst होती है और पेशाब ज़्यादा करते हैं. So that's also for someone who has diabetes and doesn't look after the diabetes very well, that can happen. But inshallah, if they change, they can definitely.
इसकी क्या कोई ख़ास वजह है कि आपने मेंशन किया कि साउथ एशियन जो है हम लोग इस पे ज़्यादा गौर नहीं करते, आपकी बातें सुनते हैं और बुला देते हैं. Is there any particular reason या कि वैसे ही उनको इतनी नॉलेज नहीं है?
I don't know, it's a combination because some patients के साथ मैं अब बात करती हूँ, उनकी नॉलेज भी अच्छी होती है, उनकी सब फैमिली भी सपोर्ट होती है. So some, I'm not saying not everyone, but majority 50% से ज़्यादा इतने changes नहीं होते. I'm not sure जे हमारी lifestyle में ऐसी होती है because हमारे पास मेहमान आते हैं, फिर हम उनको भी खाना ऐसे अच्छे खाने देते हैं, ऐसी चीज़ें. So then हम भी खा लेते हैं और हमारी lifestyle ऐसी होती है ना, we really value those guests and things, and then obviously we're busy, we might look after people, we run around, we might have grandchildren. So I don't know if our lives are just so busy that we can't, or maybe it's how people take advice. So my mum listens to my uncle a lot.
Yes, I see.
So maybe I need to ask, the people that who listen to them. Because we do, in South Asia, we're like, hala ye kehti hai, but someone who's very educated in the family doesn't get listened to, because they're not who they would listen to. I don't know. Have you found this? There's this situation where people listen to certain people, don't they?
Well, I think it's the fact, really, yes. That naturally just comes, doesn't it, really? Even with the kids, you have so many, I like what he says or what she says. Anyway, इसी के बारे में दवाई जो है, obviously, tablets वगैरह होती हैं, insulin वगैरह होती है. क्या, obviously, does every दवाई has a side effect? और क्या ये दवाई जो डायबिटीज़ के लिए दी जाती है, इससे बिल्कुल जो है डायबिटीज़ ख़त्म हो सकती है या कि होती है?
That's tricky to answer. I think different medications different असर करती हैं और depends on जैसे वो patient पर और वज़न पर, ऐसी चीज़ें. So a lot more medicines in diabetes now are to help people lose weight. So there's a lot more medicines now. आप इंजेक्शन भी ले सकते हैं. So it's not insulin. इसमें हार्मोन होती है और वो आपकी एपिटाइट को कंट्रोल करती है.
Right.
So it helps you feel full. So it stops you eating and it lets you lose weight. So वो कोर्स होता है 3 months, 6 months.
Oh, I see, right.
कई मेडिकेशन जैसे मेटफॉर्मिन हो, वो किडनीज की प्रोटेक्शन होती है, वो आपकी बॉडी में जो है ना इंसुलिन को बेहतर यूज़ कर सकता है, ऐसी चीज़ें. और दूसरी टैबलेट्स भी अभी आई हैं जो आपको पेशाब के ज़रिए वो निकालती हैं शुगर. सो द शुगर, एक्स्ट्रा शुगर इज़ आउट थ्रू द यूरिन. सो डिफरेंट मेडिकेशन होते हैं और डिफरेंट वजह होते हैं. समटाइम्स वो कहीं सूटेबल नहीं होते हैं ओल्डर पेशेंट्स में और कहीं सूटेबल नहीं होते अंडरवेट पेशेंट्स में. सो वो हर different reason होता है वो why they started. So it depends on the GP, the medical team, why they've made that decision.
Oh, I see.
But if they make changes and and lose weight and eat healthily in smaller portions, then generally you can come off most of the medications. So that is possible, and it's possible to come off insulin as well.
That's lovely.
But
That's really nice to know that, yeah, you can. अगर हिम्मत करें तो कुछ भी हो सकता है, really.
That's it. I was going to say that. It needs effort.
Effort, yeah. That is the most difficult part, though, isn't it?
Yeah. And I think family support, I think in South Asians, maybe going back to that point that you said earlier, it's very tricky, isn't it, to make healthy eating changes if everyone else is eating, samosas and pakoras or nice foods or chocolates and biscuits, so things like that. So it is very tricky, I think, in a South Asian household.
So, yeah, I mean, obviously, being an Asian lady, क्या हम, जैसे समोसे पकौड़े वगैरह मेंशन किए, इनमें से क्या हम किसी चीज़ की कमी कर सकते हैं, खा भी ले और किसी चीज़ की इनके इंग्रेडिएंट्स में कमी करें? इज देयर एनी पर्टिकुलर इंग्रेडिएंट्स जो कि डायबिटीज़ जो है बढ़ाते हैं?
So, जो वो जिनसे वो बने होते हैं ना, मोस्टली वो कार्बोहाइड्रेट्स होता है, फ्लावर होता है ना, वो जो the wrap or the chapati or whatever it's made in, that's got carbohydrates. That breaks down into your body into glucose, and obviously obviously there's fat in the food if it's fried. So if you've heard of like Acti-Fries or the air fryers, ये भी बहुत cheap है, इतने expensive भी नहीं है, वो घर में ला सकते हैं, उनमें cook कर सकते हैं या oven में डाल सकते हैं. So less obviously fat होता है और healthy portions के लिए 2 या 3 छोटे से चाहिए होते हैं, इतने ज़्यादा नहीं. So जितने ज़्यादा खाएंगे obviously इतनी carbohydrates, calories सब होता है ना. So small healthy portions, most people have heard that, small and often, small healthy portions, small healthy snacks, ऐसी चीज़ें होती हैं ना.
Right, mashallah, you're running your own company, NutriBites, and having recently done a talk about a new diet to help with the remission of type 2 diabetes. Can you explain ये क्या चीज़ है?
So last year during COVID, I set up a business with a couple of other dietitians called NutriBites.
Right.
And what we wanted to do, obviously, it was COVID. Ideally, we wanted to run study events and educate people, so healthcare professionals, about different conditions, majorly GPs and nurses and doctors. Because I used to volunteer, I volunteer for BDA Yorkshire branch, so that's my trade union, British Dietetic Association, and we run events. So from that, we realised we were doing a lot of education to dietitians, but they already know a lot of the information. But the people that can make a huge difference is the rest of the MDTs, so the pharmacists, the doctors, everyone else, or patients. So the plan with NutriBites was to have these study events or educate people through different methods to help them understand about diet and the importance of diet. So since it was COVID, we couldn't do the events in person. So we started off doing small explainer videos.
Right.
So usually you can get like a diet sheet that's got information written, but sometimes that's not good for people who can't read English very well, for South Asian community or for different communities. It's not always suitable. So we tried to make some videos for that to make them fun and easy to know, lots of pictures and diagrams. So that was one where we started. And then we started making social media posts, so informational education posts on social media. And more recently, we've started going back to the education that we wanted to do, but as webinars. So we did our first webinar last week, and we had a speaker called Adrian Brown. And he was talking about diabetes, because it's a really interesting area at the moment, type 2 diabetes. And he was talking about how you can help with remission in type 2 diabetes using a different method. So he talked about something called the very low calorie diet. It's something that has been talked about a lot last year when it was released initially. But there's studies that where they take shakes for food and they help them lose weight. So again, if they're on insulin, they can come off insulin. They would take the shakes for so many months. They lose the weight, and then they reintroduce the food after so many months. So they might do the diet for 6 months or 3 months, and then they reintroduce gradually healthy eating portions and small meals. And that helps people reverse their diabetes and put it into remission. Obviously, a lot of them lose a lot of weight. So that's what he was talking about. A lot of what I do isn't the very low calorie diet. I mostly focus, when I see my patients, on the very low carb diet.
I see.
Or low carb eating, or being smarter about the carbs you're eating, so how you eat them. So that's what I do a lot of. And we're doing another event on that in December. We've got a person coming in to talk about that.
Okay, मैं आपसे एक पहली जमात वाला सवाल पूछना चाहता हूँ. Carbs, I know we keep talking about it, and a lot of people in our from our subcontinent, वो सोचते हैं कि ये carbs जो है ये किस चीज़ में होते हैं, क्या चीज़ है, क्या भला है ये?
So as I said earlier, if anyone was listening, so rice, potatoes, pasta, chapati, flour, cereal, anything like that. Fruit has naturally carbohydrates in as well because it's got
सभी कुछ
fructose, glucose. Milk has some carbohydrates in because it's got lactose, so naturally in the milk, not a lot, and it's a very good carbohydrate, so you shouldn't cut that out, and a little bit in yogurts. And then vegetables will have a little bit of carbohydrate, but very little.
Yeah.
So again, you should always include that. It's very healthy. And then protein foods generally don't have carbohydrates. So meat, fish, chicken, eggs, and things like that don't have them unless they've got coated. And then other things, especially in the South Asian diet, so things like chickpeas, lentils, pulses, they also have carbohydrates, but they're very healthy carbohydrates to have.
Obviously, अक्सर हम वेजिटेबल्स सब्जियां कहते हैं कि अच्छी होती हैं और हम जब भी खाते हैं तो इनकी करी वगैरह बनाते हैं हांडी में बनाते हैं. Does that make any difference or is it still okay?
I think it's fine. I don't really focus on someone's curries anymore. I think it's very hard in a family to make it really healthy and make it smaller and use olive oil and the healthy sorts of oils that we say. So vegetable oil, rapeseed oil are really good, and olive oil is one of the best oils to use in cooking. But, if you try and cook with that, I'm sure anyone who's tried it, it doesn't always taste very nice. It's very strong and it can change the colour. It's very hard to reduce the oil sometimes. Obviously, ideally, if you can, if you're pouring loads and loads in, try and reduce it. But generally, if you're eating a small portion of cooked curry, vegetables, chicken, meat, whatever it is, it's not going to be unhealthy. It's protein, it's good for you. And so long as you've used some of the better oils, you're going to get the healthy oils for your heart. So personally, I think curry's good, but maximum I would say aim to have things like curry once a day because it can be quite high in calories because of that.
Well, if you don't eat curry at least once a day, oh God, क्या हो जाता है? It's so nice talking to you, Nusrat, and so interesting as well.